Well, thank you, Mr. Chairman. I appreciate you holding this hearing. In Kansas, we had 19 cases of vaccine-preventable diseases last year. The most prevalent was measles. We have not had any new measles cases reported yet this year. Our public health workers are concerned. Our parents are concerned. However, I'm concerned. The problem is that our immunization rates are down. For the 2013 year to the 2014 school year, the percentage of youngsters that have received the necessary vaccinations is now below 90. That's not good. For the record, I had measles and chickenpox and mumps and everything else that people had back in the day. But what I'm asking, if I can get to it here very quickly, if immunization rates continue to decline, what advice do you give to these youngsters' parents who have to rely on others in their community to choose vaccination to help protect their own?
The lower the rates are, the more your children are at risk. So you want to be making sure your own children are vaccinated, but also it's important to have those around them vaccinated. Some kids can't get vaccines because they have leukemia, for instance. They can't get live viral vaccines. So our best protection is that community level of vaccination.
Well, you highlight 3 reasons parents don't vaccinate: the fear of side effects, religious or philosophical objections. And there's a whole bunch of paragraphs here in the background information on which states are easier to get a religious exemption and which are easier to get a philosophical objection, a simple letter signed by a doctor. How often, however, about the mistrust of recommended vaccine schedule, how often would you say it's the latter, that the vaccine schedule is too rigorous? And what reassurances could you provide to parents on this concern?
Many parents do mention the number of shots that children get at a particular visit as something that concerns them. We like to let people know that the vaccines are recommended at the times they're recommended because of the way they work and because of the disease risk. So our advisory committee on immunization practices reviews the science of the vaccines and diseases and updates the schedule every year based on the best information available. So I strongly recommend parents get their children vaccinated on time and according to the schedule.
In answer to the chairman's question, which really nailed the issue right off the bat, there was a major Danish study published in 2002. 540,000 children showed definitely there was no relationship between MMR, i.e. measles vaccination, and any kind of problem with autism. An Institute of Medicine report in 2004 did the same. Along the way, there have been studies from the National Institute of Health, the Centers for Disease Control, hundreds of other reliable academic groups. All of these examinations point to the same conclusion: the body of evidence was firmly established a long time ago. However, this is a state issue, and that seems to be the problem. CDC is doing the very best that you can to try to convince every state. Mississippi leads. We're at the bottom, not at the bottom, but fairly close to it. I'm very concerned about it, but at least the media, I think, today realizes that one study, which was totally discredited, that there should be a very strong statement by everybody involved that they should go ahead and get these vaccinations. So I strongly recommend that, and I thank you for your leadership.